How you doing, everyone?
Hi.
Doing good? Before we get started, are we allowed to film you?
Yes.
Okay, great. So my name's Oliver. I'll be your occupational therapist for today, and I'm here to work with you to help you accomplish goals that are meaningful to you. So your doctor did mention that you've been forgetting to adhere to your posterior hip precautions, and that when you're engaging in daily activities. So would this be something that you would want to address, and we can work on a solution together?
Yes, I would really like to learn more about my hip precautions, um, especially when I'm getting out of bed or doing chores around the house.
Mhm.
I get pretty stressed out while taking care of the kids that I completely forget about my hip surgery.
Okay, that sounds great. That totally makes sense, especially when when you have a lot going on. That's an easy thing to forget. We're going to make sure that your hip heals in a safe manner, and that you can be as independent as possible and safe. So the problem statement is inability to adhere to hip precautions due to stress. Uh, Puts client at risk of re-injuring hip and falling. All right, so Nirman, what we're going to do is first we're going to do an assessment here. So it's kind of like a survey, and I'm just going to ask you some questions and try to. There's 12 of them, and you can try to just answer them the best that you can. All right.
Okay.
So I want you to think back for the last 4 weeks. What just Yeah, so in the last 4 weeks, this is going to be where your pain and hip functioning is, all right?
Okay.
So this is called the Oxford Hip Scale. Okay, so how would you describe the pain you usually have in your hip?
Moderate.
So moderate, okay. And have you been troubled by pain from your hip in bed at night?
Some nights.
Okay. And what about have you had any sudden or severe shooting pains in your hip?
I would say some days.
Okay. All right. And have you been limping when walking because of that hip?
Sometimes.
Okay, sometimes. All right. And okay, so for how long have you been able to walk before the pain in your hip becomes severe?
No pain for like 30 minutes.
Oh, okay, so it usually takes like a little bit longer, like more than 30 minutes.
Yeah.
Okay, cool. All right, great, thanks a lot. And have you been able to put on a pair of socks or tights?
I would say moderate difficulty.
Okay, oh, great. So maybe we can look into that for you. So after a meal, how painful is it for you to stand up from the chair because of your hip?
Kind of painful, like moderate.
Mm-hmm. Okay, great. And have you had any trouble getting in and out of the car or using public transportation because of your hip?
Moderate again.
Moderate again? Okay. And have you had any trouble with washing and drying yourself?
Not too much, no.
And, okay. And could you do the household shopping on your own?
Yeah.
You could?
Yeah.
A little difficult though?
Yeah,
Yeah.
a little bit, yeah.
Okay. Alright. And then have you been able to climb a flight of stairs?
Moderate difficulty again.
Okay, great. And then the last question here: how much has pain from your hip inferred with your usual work, including housework?
Not too hard, but not too low, so moderate again.
Moderate. Okay. Okay, great. So we're gonna tally up that score, and you got a score of 27. So with the Oxford hip score, a score of between 20 and 29 may indicate moderate to severe hip arthritis, and usually there's a recommendation that they see their family physician for an assessment and x-ray. And it also says to consider and consult with an orthopedic surgeon. All right, perfect. Thank you, Nariman. So that's been great. Okay, so something that you can do that might help you with your hip precautions. So just make sure that that you're not bending your hip past a 90-degree angle. And what that means is that when you bring up your leg, say if you're sitting down, you don't want that to go past this. See this 90 degrees?
Yeah.
This is past 90. So that would be infringing upon that. So you just want to make sure that, especially when you're like, say if you're reaching for something, that you're gonna break that as well. So just know that when you're reaching for something in the closet or in the food pantry or something, that you just be aware of that. And we can set up techniques. What we can do is we can put reminders and maybe colored reminders to in those high frequency areas, so that you remember not to break them in those specific areas that you're having trouble with. And then another big one is, I'm not sure if you do this, but crossing your legs. So you make sure you do not want to cross your legs. Even when you're laying in bed, like you said, getting in and out of bed, make sure that you don't cross your legs in bed.
Okay.
All right. And then the last one here is don't twist your hip inwards. So we call this internal rotation of the hip. So it's when you bend your hip in like this, and that could happen if you're shaving or something. It's easy to do that. So just be careful when you're shaving in the shower that you're not what we call internal rotation, or rotating the hip inwards.
Okay.
So what we're going to do is we're going to make sure that we put some pictures up in the bathroom, in the bedroom, in the kitchen, and we'll post reminders as well, maybe on your text, to remind you as well when you're getting in and out of bed. Okay. So lastly, to summarize this intervention plan, the approach that I used for this intervention plan was restore and prevent. Giving skilled instruction on how to adhere to hip precautions while doing daily activities. I used the Oxford Hip Score to assess the functional ability of the client's hip and the associated pain with that. The session resulted in educational hip instruction on precautions and why they are important. Client would benefit from further skilled instruction in maintaining precautions during ADL tasks, sit to stand, and transitional living skills. The long-term goal that we came up with was the client will sleep the entire night with no pain while adhering to hip precautions within 4 weeks. Lastly, the short-term goal would be client will transfer from supine to sideline with minimum assistance within 2 weeks. Thank you, Nariman.
Thank you so much.
You're welcome.